You are going to book a meeting from a meeting with a lot of folks, and you are going to get a lot of referrals, because referrals equals what? Freedom.
Hey everyone, Steve the Hurricane here, and on for today's episode of A Drink with the Hurricane, we're going to talk about the most important key contact at all referral sources. So raise your glass and let's toast to your success. Cheers. This is A Drink with the Hurricane, the talk show discussing all things growing your home care business. This video is sponsored by Home Care Evolution, where we help home care agencies adapt to changing circumstances, transform their business so that they can thrive for years to come. So folks, here we are, we're talking about the most important key contact in a referral source. And I just wrote an article for the Home Care Pulse talking about this exact subject, because it has always been, before, during, and now after the pandemic, it has always been the most important key contact at a referral source is the administrator. Why is the administrator the most important key contact at a referral source? Because it's simple. They are the boss. If you want to be able to market to that building, you need their blessing. If you want to get referrals from that building, you need to know that administrator and how to properly leverage a working, referring relationship with your administrator if you want to be able to get referrals. Plain and simple. I've had referral sources where I didn't know the administrator stop referring me because the administrator told their staff to refer other people. On the flip side, I've had accounts where I didn't know anyone except for the administrator, and I got a ton of business from and through that administrator. So they are always the most important contact at a referral source. So now there's three parts to building a relationship with an administrator. Like, what can I do, Steve, to get referrals from the administrator? And so the first example I'm going to go over is you get to be the eyes and the ears for the administrator as to what the reputation is for their building outside of their organization. One of my favorite clients, Stacy and Franny, who you see in the pictures right now here, they built a huge multi-million-dollar business off of their relationships with administrators. They are the sounding board for that administrator. So when they come in and they sit down and they talk to an administrator, they go over what the reputation is on the street for the business that the administrator is representing. Sometimes it's, we haven't heard anything about your account, and it could be a positive or a negative that nobody's talking about it. Sometimes it could be, hey, listen, administrator, we heard something happened here. I just want to let you know that people are talking about it, good, bad, or indifferent. But by giving that sounding board information to the administrator, it allows them to know what tweaks and what direction they need to take the business going if they want to get the growth that they're after. I think back to when I had my relationships with my administrators, and there's one in particular that really stands out, a buddy by the name of Bob. I won't say his last name for just in case you know who he is, because he's a great administrator. But every time I would sit down with Bob, he and I would talk about, what do people think of my building? What is the reputation on the street? What do patients say when they get discharged from here back home, how their experience was? Like, give me the real rundown. And I was very honest with Bob. If I heard something good, I let him know. If I heard something bad, I let him know. And if I didn't hear anything, I let him know. In all situations, being that sounding board is a huge, valuable resource to an administrator and key in developing a long-term relationship. The second thing you want to do is give updates on outcomes of patients that they've sent to you. If you have a referring relationship with your administrator, that means that they're sending patients to you. It is in both your best interest and their best interest to know that you are giving them positive outcomes. What do I mean by a positive outcome? When you think about a nursing home, a rehab center, an LTAC, even a hospital, all of these places get penalized when there's unnecessary rehospitalizations upon discharge within a 30-day window. How do you avoid it? By having private duty home care. You actually fulfilling your services, helping with activities of daily living, bringing people to the doctor's appointments, helping them get dressed, showered, bathed, whatever it is that this person needs, when you do that, you improve the outcomes if that person is somebody who they felt was going to get readmitted to the hospital. By you keeping that person home, going back regularly, following up, and don't just follow up to follow up. Follow up in a timely fashion. Follow up at the 30-day mark and say, hey, Bob, guess what? I'm here today because it's been 30 days since we brought Diane home, and we've kept her home and she did not end up back into the hospital. By improving the outcomes of our referral sources, we can actually help them leverage better outcomes to grow their census. What better way to create a true working referring relationship than to improve the outcomes of our accounts? Finally, the third thing, which I'm going to say is the most important one, because in order to improve outcomes, you have to get referrals. So there's a catch to it, right? We have to get referred in order to be able to improve the outcomes. So we have to start the relationship to get them to refer us so that then we can deliver on the improving the outcomes. So I actually like this one better, and this is collaborate on events with the administrator. All right, so when you think about what you do for a living, you are a home care agency, you're trying to get more patients. So are our referral sources. One of the best ways that everybody is familiar with on how to get patients is by doing events. You can do events for the public and invite people to come to the community that you're trying to partner up with, and you're one of the co-sponsors. So you facilitate the event together with them. Their building is showed off. You're there getting the contacts and all the information as well, and then you share in the risk. I've also had people do CEU events for hospital discharge planners and hospital social workers, and you have it at a nice restaurant or a nice hotel where people could come, get some food, get the credits that they're after, and then have a nice experience at the same time. And you share in that cost. You share in the planning. You share in the inviting and gathering the RSVPs and everything else necessary to pull off this event without a hitch. When you do these collaborations, this is you actually working side by side with your administrator over several weeks to several months' time to pull off the event. What happens is you develop a true working and, more importantly, a trusting relationship that will lead you to get the referrals that you're after. So there you have it, folks. These are three quick tips on developing a relationship with the most important key contact at your referral source. If you have been watching these videos and you like these videos, you know what you need to do? You need to register to come to the next Home Care Evolution Conference. We have one coming up soon where I can give you everything that you need to blow away the competition. So click the link right now below and I'll see you at the conference.
I'm Steve the Hurricane, and I spent 3 days teaching all these people how to